Hi. I hope my audio is clear.
Yes, it's clear, Ketan.
Okay. Yeah. So we'll start in 2 more minutes. We'll wait for a few more people to join and then it's. Hello, everyone. Good evening. Welcome to today's highly anticipated webinar on starting solids from Cloud9 Hospital. My name is Kirtana, and I'm delighted to be your host for this session. And we are thrilled to have you all here for this session today as we embark on a journey to explore the world of complementary feeding for the babies. We all know how crucial it is to get the right start when introducing solids to our little ones. Today's session promises to be an invaluable resource in guiding us through this important milestone. Our esteemed speaker for today's session is none other than Ms. Haripriya, a certified dietitian practicing in Chennai T Nagar branch. So she is excelled in managing metabolic disorders, fertility, gestational diabetes, PIH, gastrointestinal disorders, cardiovascular conditions, liver diseases, renal conditions, and pediatrics with medical nutrition therapy. So she holds a master's in the master's degree, uh, and she's a certified clinical nutritionist, as mentioned before. And she excels in preparing customized and personalized diet charts by understanding every customer's medical condition, their lifestyle, culture, and the traditional cuisine. In today's session, in addition to, before we begin, a quick note on the session format. So, Ms. Haripriya will be sharing her insights on the essential topics like preparing and principles of feeding first, managing the textures and varieties, and also providing crucial nutritional guidance along with the recipes. So we will begin by sharing Ms. Haripriya's insights during the first part of the hour. Following her presentation, we will open the floor for Q&A. Please feel free to post your questions in the chat box throughout the session. We'll address them after she concludes her task. Without further ado, join me in welcoming Ms. Haripriya.
Thank you so much, Kirtana. Thank you so much for the kind introduction. So I'll just start sharing the screen now. I hope the screen is visible.
Yes.
Very good. Okay. So I'm really happy to start with the great evening of starting solids. And first of all, I would like to congratulate all the mothers over here for successfully completing your infant 6 months of age. And I know that this journey is not that easy. It's very difficult to just reach this level. That is half of the milestone being achieved, and I know everybody will be really happy in and be awaited in starting solids for all your little ones. So after the session, I hope everybody will be really, really confident enough to start solids for your baby, and you will master this, of course. So without any delay, let's jump into the topic of what is starting solids or a complementary feeding. So generally starting solids or complementary feeding is like giving breast milk along with the solid. It's not like only solid or only breast milk. So we are just complementing the breast milk and giving add-on solids to nourish the baby to meet up the extra demand that is needed for baby's growth and development. Okay. So why do we really start solids for all the babies? Because the baby are developing better and their digestive enzymes are being secreted, which is good enough to digest the natural food being present. For example, if we say the amylase, lipase, or the carbohydrates, monohydrates, or it can be any protein, amino acids, vitamins, and minerals. This can be digested by the baby on its own without any of the dependent hormones or enzymes needed, because these being naturally secreted by their body. So from 6 months, they are really good enough to start with the solids. But in some cases, like if it can be a premature baby or it can be little baby with lower birth weight. So for those baby, we might start from 5.5 or 6 months in the starting itself based on the pediatrician, the green signal. Okay. So first thing is, why do we really start solids is to meet up the nutrient demand for the baby. Breast milk alone is not enough for the baby's growth and development. You have to add on with the solids where it gives you complex carbohydrate, enough protein and vitamins and minerals, which is needed for baby's height, weight, head circumference, and the entire organ maturation, and also to ensure that the baby is not being risk of developing any malnutrition. So to avoid all these risk factors, we are going to start solids for the baby, and also to improve the teething, to improve the oromotor stimulation, to ensure that the baby's facial muscle being developed, and also for the entire growth and development. So when do we really start with the solids? So from based on WHO recommendation and IAP recommendation, Indian Academy of Pediatrics, we do start solids at the age of 6 months complete, and we can give solids along with the breast milk till the age of 12 months. After which you can continuously feed, breast milk till 2 years, the continuous feeding. Then after 1 year, solids will be converted into a family pot meal. So I'll explain that further in the future slides. So this is important to start, but do not give any prelacteal feeds before 6 months of baby's age. So what do you mean by prelacteal feeds are basically anything. It can be any food particle like sugar, water, or honey, or it can be jaggery, or just anything starting as a food particle. Before 6 months, we call it as a prelacteal feed, where the baby cannot digest those items, and that will really impact their immune function. So based on the guidelines, we're going to start at 6 months of age. So what are the benefits of starting solids or giving the first food for the baby? So generally, there are n number of benefits, not only short term, but also long term benefit. Long term benefit are basically we can prevent the risk of obese and overweight in future for them, and we can prevent the risk of metabolic diseases like type 2 diabetes, cardiovascular diseases, obesity, and it can be hypertension or any autoimmune diseases can be prevented. So these risk factors can be prevented if the baby is being breastfed and properly started with the starting solids. And next important short-term goals are basically to prevent too much frequency of fever, cold, cough, infection, bronchiolitis, asthmatic issues, or it can be any infections related to the food and intolerances. And what are the benefits? I would say first is psychosocial development. So by eating itself, they're just learning how to chew, how to just swallow, and it's like how to eat along with the mother and father. So they know what is a meal time, they know how to improve with their eating habit, and they know why we are eating food. So all these importance of having nourishment, diet, they'll be knowing and learning about it in this first 6 to 12 months of their age. Second important is reduce risk of gastrointestinal infections like less diarrhea episodes, and it also prevents a lot of respiratory infection. Apart from that, malnutrition, as I told you, a lot of babies in pan India, or I would say generally in the urban population, they are really having a stats of malnutrition where they are going less than -3 standard deviation of percentile, where the baby's age and weight is not adequate, baby's height and weight is not adequate, they are severely malnourished. It is not only because of the calorie quantity and the nutrient demand, but I would say we call it as a hidden hunger. Hunger is basically lack of micronutrient deficiencies like zinc, vitamin A, vitamin C, iron, and calcium. These are the important nutrients which are lacking in the quality of the diet of the baby, which leads to very difficulty in gaining weight after 6 months, because till 6 months we could able to see a good span of weight gain, and it's like a consistent growth for the baby. And there'll be a growth spurt where baby will be stop gaining weight, or the baby will be little stagnant in gaining weight after 6 months. It can be because of not giving solids properly. It can be because of improper texture transition, because of not giving variety of diet in the food. All these things might causes a combination of nutrient deficiency that might lead to baby's malnutrition. So by giving a proper kickstart to the solid, this can be achieved by just preventing all these complications. So apart from these things, you can reduce the risk of child mortality, where because of malnutrition, a lot of children below 5 years of age are really causing a lot of infections, and the mortality rate is very higher, the death rate is very higher. So to prevent all these things, proper solid starting is more important, and less risk of anemia, because you're going to start first food which is iron rich. And also pediatrician will also give you iron supplementation, which is very important to improve the baby's appetite and also to meet up the nutrient demand. As the baby grows, the breast milk quality of it get reduced, because the baby growth and demand of the breast milk will not be adequate. So it's like a good immunoglobulin that you're supplying for babies via breast milk, but not as good as a solid. So ensure none of the food will give you proper immunoglobulins or that boosts the immunity except breast milk. Rather, you can just complement that with the solids too. And apart from these things, optimal growth reduces the risk of zinc deficiency and other micronutrient deficiency. To start with varieties of diet in the infant's diet, and improve productivity and economic status. Cognitive behavioral therapy, which is very, very important. The baby could able to improve their more oromotor stimulation, and also the brain development would be better. So all these things are important to start a proper solids, and these are the benefits of the complementary feeding. So before that, we should always keep four key pointers in mind, where you have to feed them on time. Okay, and adequate feeding is more important, and appropriately you have to give, which is the quality of that, and safe and hygienic practices to be done for the baby's starting solids. If you're not following all these four keys, then it might land up to infections or allergies, or it might also causes any infections, or it might also lead to stagnant weight gain. Okay, and now when you're really ready for the starting solids, you can also see those signs in your infants. So if you could able to see that when you're eating any solid, if you're having your meal or a snack or something like that, your baby will be really interested to come and grasp your food from your hand, or they'll literally stare at you, be seeing at you that can you give it to me, okay, like a puppy face they keep. So all these things are signs that they're really ready for solids, that they know that the smell and the taste and the something different that you're eating apart from what they are having as a food. So they'll be really interested to grasp it, to get it from you. So that means the baby is ready for solid. And second thing is they could able to hold their head up. Okay, they could able to look at you like this, and they could able to sit with less help. Okay. Apart from that, they will easily open mouth when you give something nearby. They'll just wide open the mouth and come and grab it when you give something, as a food, and if you go nearby to them. And they will always chew their fist, okay, because the chewing ability is slowly developing, so they could able to chew their fist and watching others eat with interest. This is what I told you. So it's like they'll be literally coming and grasping you if you want to have something as solid. So apart from these things, as I told you, first and foremost, it can be a caretaker, or it can be a father, your grandmother, or your father, or your mother, or anybody who is cooking food for the baby should follow safe hygienic practices, which is very, very important. So this will be helpful to prevent staphylococcal infection, amoebiasis, a lot of human and infant transferred all these food poisoning can be avoided if you follow a safe hygienic practices. So first thing is wash your hands before handling the food. So before every feeding or every usage of the dry ingredients, you have to wash hands properly. And also before going to the washroom, after coming out, and also ensure when you're touching anything, it can be a key or it can be any remote or something like that, you have to wash your hands and then you have to resume your cooking. Do not just like that use everything commonly, because a lot of infections will acquire for the infants. The immunity is still compromised. Okay. So till 1 year, we should be really cautious because their gut is very sensitive. Second important, ensure you use a clean vessel for storing and preparing baby's food. So it should not be the same vessel what you cook at home and also for the baby. Just have a tiny wala one or tiny vessels for your kids separately, at least for 8 till 8 months. Okay. So you can have a tiny cooker for them. You can have a tiny kadai for them. You can cook whatever you want to in that child's vessel itself, but do not use your one and their whatever the infants cooking together. Okay. And also in the sink or wash basin, whatever we call, in that you should not put the baby's cutleries and your cutleries together and wash it together. That should not happen at all. So you should finish off the baby's washing and sterilize it properly, store it away, and then you use all your thing, because the saliva which will be present in the remains of the food, and it can be some infections, whatever, it might get acquired for the baby too. So be cautious about washing the vessels separately. And apart from that, ensure thorough washing of utensils in all containers in the sense the one which you will store the baby's puree, or it can be the baby's pacifiers, or it can be the spoons and cutleries of there, or the silicone bibs you wear, or it can be the high chair, whatever it can be. Ensure it's completely properly cleaned. Okay. The baby will make it up messy, but it should be our patience level to be tested, that whether you have to clean it on a routine basis or you're feeding baby in the right position. Okay. Now, what are the must have for the starting solids when you're starting with the major solid food? So first thing is blender, but I would suggest that blender is just for few days. Okay. It can be for first 1 week or 2 weeks. You can just use the blender to puree it, but rather the baby starts solids very fastly and they could able to tolerate it. Then you can slowly boil it and you can mash and you can give it for the baby to make it as a puree. It's not really mandatory to go for food processing or blenderization all the time. It's just you can just mash it, boil it, and then you can just give it as a pureed form. But do not use blender all the time. Do not blend all the ingredients together. Always juicing it up and giving it for the baby, which will affect the gut health of them. Okay. So blender is just for few days. You can start giving it from the start, and after which you can make a use a mutt. We call it as a masher, and then you can mash it and give it for the baby. Second important is the food storage trays or jar or freezing trays, whatever we call it as. These things can be used properly and hygienically to store the baby's food item when you're traveling. And third is the silicone bib. Silicone bib is basically to prevent any dirty to be happened on them, or when they are putting it down, they can take it and have it in the silicone bibs. All these things can be done. So silicone bibs, few babies will do it, few babies will not use it because they'll become cranky when they're using something new. So what you can do is you can either follow your own way of practicing or seated method of babies, starting solid. For example, if we say the old 90s or 80s, our parents will usually make us to sit in a good placement mats, or it can be, we call it as a, floor mat, and we'll be sitting on the ground. Then they'll be feeding us with the hands only. Okay. But nowadays, what happens? There is a high chair, and the baby should feed on the high chair only. All these things are not really mandatory. You can make the baby to sit on a high chair if you want that, particular habit to be followed. Otherwise, you can make the baby to sit on the floor mat, and you can sit along with the baby. With the assistance, you can feed the baby with the spoons. Okay. So you can have silicone bibs, you can have high chairs, and you can also use sippy cup. Sippy cup is basically only for the liquids. That is for the water alone. Do not give any formulas or any juices or any purees in the sippy cup. Sippy cup is only for the water. And do not use bottled, nipple shaped bottled feeding to give any of the natural food ingredient. I would say I have seen mothers giving, water or juices or any soups in the nipple feeding formula bottles. So that is not the right way of giving. Formula bottle is only for the formula. Do not give any natural ingredient or water or anything in the formula feeding bottles. Okay. And apart from that, spoons and forks are very important. Why? Because the normal spoons, whatever we are getting in the shops, that is just for us, for the adults to just take it. But if you could able to see the spoons of the little one, the shape itself differs. Okay, you could able to see this, that it's not a completely oval one. So it's like a narrow oval one where the baby could able to have it properly, and they cannot take everything from this. Okay, so they'll just have a small dip or sip of it, but this is specifically made for the baby's palate to avoid any damage. Okay, so make sure that the baby spoons and forks are little blunt and should not be sharp all the time. And next important is bowls and plates and placemats to be different. And if you are giving, baby led weaning or something like that, no, when you're keeping it on the plate, they will just throw it off like anything. So instead, what you can do, you can buy this placement mats and it will be fixed in the floor. And when the baby is also moving the plate, it will not get spilled out. Okay, if you want, you can also buy those things. And next is a food feeder. Food feeder are basically to give the snacking option in a nutritious way, but this to be started after 8 or 9 months only during the teething time, but not in the initial phases. So, okay, so you should not give any of these things during the initial phase, only after 9 or 10 months, where you can keep some frozen watermelon or strawberries or berries inside. You can just give it for the baby and they can just suck it, just to ensure that they have a soothing feeling in their gums, okay, during the teething time. But do not keep this just like that and make the baby to sleep or just play somewhere and throw this outside, again keeping it inside the mouth. That should not be happening. Okay. And next is you can also get some masher bowls or something as a separate bowls. So where it will be with the longer holes. So if you could able to see, even the masher, whatever you're using, it should not be like a complete puree type. Okay, it should have a bigger holes where the granules or whatever we mash it, the food particles to come, before this. So ensure that you just give the masher, good massage. And after that, what you have to do is ensure you just have to check with the strainer too when you're giving it as a puree. So that to avoid any choking hazards that is been happening for the infants. So these are the must feeding things you have to have for all your infants before starting solids. I would say first the blender, and second is some bowls and plates and some cutleries like spoons and forks and everything. Sippy cup you can start, or you can also go for the open tumbler or a bowl or katori or spoon. Anything is fine when you want to give water for your babies. Okay. So now let us, start with adding some flavors to your baby's diet. So everybody will have this doubt that what is the first food that I can start for my baby. So I'll just list out, some of the few easiest pointer that you can note it down. First is based on the food groups, you have to start with the solids. Okay. So I would say cereals, or it can be any types of, grains. So first is rice. So in cereals, you can give rice, ragi, and wheat. So these three items you can start for your baby as a first food. Can make a puree out of it either from the powder or from the milk that we are extracting from those cereals. So from cereals, it's rice, ragi, wheat. And second, from pulses, you can give tur dal, moong dal, and chana dal. So these things can be made as a puree and you can start for your babies. And third important food group is fruits. So fruit you can give mashed banana, stewed apples, stewed pears. You can also start with chiku. And fourth important is you can also give few vegetables, like it can be beetroot or carrot, like a mashed form or in a puree form. So you can give beetroots, carrots. You can also start with pumpkins and potatoes and sweet potatoes. So these are the vegetables that you can start for your little ones first food, as a first food. Okay. And so how can you make it as, first food? So we call it as a puree. So what is meant by puree? Puree is not like blending up, adding water, making it very loose and watery so baby will not have choking hazards. No. Okay, generally puree means it's free of water. So if you say for rice, ragi and wheat, or for the pulses to cook, you can add water to it because that is a starchy one which needs some water to get cooked for it. But for fruits or for vegetables, do not add any water. Rather, when after you cook, to loosen up the consistency, you can either pour your own breast milk, or you can add dal boiled water, rice water, or it can be vegetable boiled water. But do not add any of the plain water or formulas along with the natural food. So do not mix any of these things with your natural ingredient. You can loosen up the consistency with the vegetable boiled water, dal boiled water, or rice water, okay, which add on some starch and micronutrients with those boiled waters, okay. So now, if you say puree in the sense, when you're taking, there's something called a tilt test to be done, okay. So if, for example, if I say this is the baby spoon, when you take the puree, when you tilt it, it should fall very slow, soft and smooth, okay. I'll just show it like this. Okay, when you tilt it, it should fall very slow, soft and smooth, okay. It should not be like a watery consistency. So see, it's so soft and smooth only. Okay. So you should not add much of water to the puree. It should be seen like this. But do not, give it in too much watery form, because what happens is generally when you are adding a lot of water, it might land up in diluting a lot of micronutrients. So the baby's capacity, the amount of food they eat per shot is very less. So for example, if we say it will be just 1 tablespoon or 2 tablespoons in the initial days. So when you're adding water to it, they couldn't able to have that food properly. So make sure that you don't add much of water, rather you make it in a softer and smooth consistency when you're giving the puree items, okay? And next up. So apart from these purees, you can also, give the babies in different textures. Like you can start with puree, then you can, make it to a bigger granules and in a mashed form where you can use your hands and mash it and give it for baby. So all these things of different texture you can do. But keep in mind that choking or it can be gagging or spitting out is very common. Choking, you have to understand that's purely because of the raw food or the wholesome food or something as a different texture which causes choking hazard. But there is, something called as the gagging, or, it can be spitting out, which is very common for babies who are starting with the solid because they're learning how to chew. So if we say learning how to chew, when we are doing this movement, that is, okay, chewing movement, they will not be doing it because they are used to feeding breast milk, okay. So what they do is they'll just use their tongue to spit out the food outside. So when they are learning how to start with the puree and learning how to chew and swallow, they could able to get that movement where they will use their tongue to move food around the mouth and they will swallow it slowly. So when they're learning all these things, for sure they will either spit or they will either spit out or reflex or anything that has been happening. But that's very common. Do not worry about it. Only choking hazard, there are a list of foods that is to be avoided. So that will be showing in the later slide. So that to be avoided. Remaining everything, you can just give it for the baby because texture transition is a very crucial phase. Okay. Now, there is something called as 3-day rule, which has been there in the slide now. So, new food trial, whatever food you give, it can be, I told you, right, the list of foods like cereals, pulses, fruits, vegetables. So, all these things, when you're starting first time for the baby, you should always follow a 3-day rule, food trial method. So, that is basically when you're giving rice for the first time. So, you have to give rice for day 1, day 2, and day 3. Only once per day, okay. So only one meal once per day. So rice day 1, rice day 2, and rice day 3. When you're starting the new food, next food, that is, it can be a stewed apple. So that is for day 4. So you have to give day 4 apple, day 5 apple, day 6 apple. But the second meal can be a rice, because the rice has been already passed from the 3-day rule. So whatever food is being analyzed and passed from the 3-day rule, that can be given as a second meal for the baby. Okay. So initial 6 months, or it can be start of 6 months, it's just 1 or 2 meal per day along with the breastfeeding. It's not like 3 meal or 4 meal per day. Okay. So just keep these things in mind and you can start with. So this applies in any time of the age. For example, if you say it can be a 1 year, It can be, around 8 months when you're starting with non-veg, or it can be from egg yolks, or it can be any new food that you're starting. It should always be a 3-day rule. Even if you start spinach after 7 months, it's a 3-day rule. You have to give spinach for 3 days continuous. First thing is start early in the morning. That is in the daytime. You should not try it late evening or in the night. Anything new, if you try, that will causes a lot of serious illness if they acquire food infections or allergies. So keep in mind anything new to be started early in the day and to be given only once per day. Do not force feed. Ensure you just give as a single ingredient. So if you say rice, rice alone. Do not mix dal on it. Do not add ghee to it. Do not mix any vegetables to it. Please don't do that. Okay. Ensure if you give anything as a starting solid, only single ingredient for the first 6 months. And then you can mix it up like dal and rice together, dal vegetable together, rice and vegetable together, or any mixing of ingredients are fine. But do not give everything at one shot. Okay. So initial days, it's like food trial and error method, single ingredient at a time. Follow 3-day rule. Okay. Give cautiously and start first thing in the morning. Do not give anything new later in the day. Okay. And now, next, if you could able to see, we know what to start and when to start and how to start and how much to start. So everybody will be really confused about the quantity of the feeding food, right? So if you say quantity of feeding, the baby's appetite is very little. Okay, they'll feel hungry. You might seem that the baby is really interested to having one bowl of puree, but they couldn't able to eat it. Okay, they'll be very randomly coming and grasping it, having 3-4 mouthful, but they couldn't able to eat the sixth mouth. That's because their capacity is only that much. So now let's see how many months and what is the quantity that is needed. So first important thing is, from starting 5 to 6 months, that too based on each baby's requirement, we do start, but not after before 5 months or something like that. So 6 months, the quantity is 50 grams. 50 grams is generally 2 to 3 tablespoons. That's it. Not more than that. If you say tablespoons, it's generally this much. Okay, I'll just show you. So this is 1 tablespoon. So this is 1 tablespoon. Okay. And not more than 2 or 3 tablespoons they do take. Okay. So when you're overfeeding the baby might feel cranky. Baby will not be interested to have any food on their own. Okay. So they'll become a picky eater in future. So please ensure that do not force feed the baby and do not give anything that the baby is not accepting. So the baby might have a picky eating habit, or the baby will feel little dislike in certain food. That's because the texture is new, the color is new, the varieties are new, the taste is itself new. So obviously they will ignore. But there's something called as rule of 15, where you have to try and try and try for 15 times till they start consuming their particular food ingredients. But you have to give it and try it in different varieties, different textures, and different days. For example, if your baby is little reluctant in having spinach, try it at home. Or if the baby is not eating, try it at your grandmother's home or your mother-in-law's home. So different, you can also shift that to different room and give it. So when the baby is changing their mind, the environmental, place or something like that, they will have that mentality to try and have it. Or a simple example is when the baby is not eating properly, or the baby is not liking that specific food, you have to eat in front of them. For example, if the baby is not eating spinach, you have spinach on your own. Okay, you have it in front of your baby. The baby will learn, will see how you are chewing. They will start eating after 15 days, or it can be even after 1 month. But obviously, they will try having it. But in any of the ways, you should not fix that this is the baby's liked food. This is the baby's disliked food. No. There is nothing that has been liked and disliked before 1 year of the baby's age. Okay. So keep that in mind and start giving and ensure that you give everything and anything before completing 1 year. Okay, except the allergenic foods. Okay, this is how it's very important. So 6 to 7 months is 50 to 75 grams, 7 to 8 months is 75 to 100 grams, and 9 to 12 months is 100 to 150 grams, where they will reach only half a cup of the amount. So this is the feeding amount for one shot, one particular meal. Okay, it's not the entire day. with one particular meal. Okay, but you can, make them feel frequent, and you can feed them with, assistance. So now, as I told you about the texture and the frequency and the consistency of it. So this is how you have to change. For example, initially we are starting with the puree. As I told you, this is the puree, okay? And after giving the puree, you're going to go for the mashed form of it. So mashed form will be little, bigger in the consistency, and it will be like with the larger particles of the food item, okay? And next, after which 9 to 12 months, you'll be giving the finger food like this, okay? Finger food like this, which is boiled, and it should be mashed. So when you touch it or when you squeeze it, it should be like this. It should break down. It should not be a raw food, okay? So you can just give this as a finger food where the baby can take it on their own. They can have it in their, mouth on their own. They'll be having, this will help them to basically improve their, oromotor stimulation, and also it's like a developmental aspect where the baby is having a grasping finger, stimulation, and then palmar grasping. All these things they will learn where this oral and motor stimulation is happening. Hand mouth coordination will be very much better. Otherwise, I have seen babies not eating onto their own only. So always the mother should feed, or anybody should feed the baby, but the baby will have the food, they will play, but they will not keep it inside the mouth. It's purely because you're not allowing them to do it. Okay. So usually it will be messy. First, when you're giving any new food for the baby, initial days, what the baby will do is the baby will take it, they'll just chew it, and they will spit it out, or they will just play with it, they'll just throw it away. Okay. After giving it continuously, they'll try, okay, this texture is little new. Why can't we, have a good taste of it? Then they will keep it inside the mouth. Okay. So you have to allow them to try and play and then to eat. Okay, so you have to give some specific meal alone for it. It's not like I'm not telling all the 3 meals or 4 meals, make them to eat on their own. No, any one meal. You can, like a evening snack or something like that. You can ask them to do all these things. It's called as baby-led weaning. Okay. Fine. So these are the texture. So the critical window period is basically introducing lumpy food from the solid food. Okay. Because a lot of mothers will get afraid what my baby gets choking. What if the baby couldn't able to eat it? No problem at all. The gums are very strong. Okay. The gums will do the teething part. So the baby could able to chew with the help of the strong gums that is happening. So one sign that you can see is when the baby is really biting you, the baby is ready for having the solid food. So you can keep this in mind, and you can, feel free to start solids without any, fear for your infants. Okay. Fine. So this is the texture. This is a good picture where these are the texture which I showed you now. So from the puree to the cooked and mashed carrot, and to the cooked and soft diced carrot. Okay. Now this is the IAP feeding guidelines where initial days the texture can be little thick or purees, or you can give 2 to 3 meals, which is the frequency as I told you, and the amount is 2 to 3 tablespoons only. But 9 to 11 months you can give finely chopped or mashed food, but the frequency is 3 meals plus 1 snack. Okay, where after 10 or 11 months you can start with 3 meals plus 2 snacks. Okay, along with the breastfeeding, which will improve the appetite, and the quantity gets bigger when the baby is growing larger. So let's see about a gist of what are the neurodevelopmental aspects of feeding for the baby. So first thing, as I told you during the introduction itself, it's like they will learn how to eat. It's not only about the food, but about the health concept where they're knowing that these are the healthy food that I'm eating, which will be important for my skin, for my hair, for my growth, to make me feel stronger, to run faster, to learn better. All these things they will learn when you're teaching and feeding them. So do not just ensure feeding time is just feeding time alone. It should be combination of fun, learn, feeding, and activity. Okay. So 5 to 7 months, they will take food from the spoon, moving food from front to back, and they will swallow. And 7 to 9 months is moving lumps around the mouth. They will try to do it, and they will not spit it much. And you could see the drooling being stopped better. Initially, the baby could able to drool like anything. You could see the saliva just running from the mouth. But when you're starting with the solid, you could able to see that the drooling is being little reduced. Okay. And apart from these things, self-feeding can be done after 7 or 8 months with the assistant. Till 1 year, not without assistance, only with your, assistance, the baby should feed on their own. Okay. And apart from that, 9 to 12 months is chewing minced soft food, and they could able to chew better. And self attempts with a spoon and blunt fork is possible. So they will itself put the fork in the bowl, and they will pick up the food and they will have it. So this will happen from 9 to 12 months. Okay. Speech and dental development is very important, because only if you do a proper texture transition, they could able to improve on their teething and speech better. Okay. So orosensory development, gum stimulation for teething, texture transition, only if you do that, all these things are being covered. And same muscle that's involved in chewing, it's also important for the head circumference growth. And it also helps in speech development better. Okay. So what are the liquids that you can do? So I would suggest juicing, or giving fruits as a juice is not recommended, because we are itself starting as a puree only. But what can you give it as a juices for the baby? You can give diluted lemon juice, or mosambi, or pomegranate juice. Something is just hard particle that the baby cannot chew. That can be started as a juices when the baby is more than 8 months. Okay. Till that, you can give all the food items in the pureed form itself for the baby, or you can make it as a mashed food and giving it for the baby from the age of 7 months is also fine. So, at 6 months, boiled cooled water can be given as a plain water. You can focus on these things, where just 1 tablespoon is more than enough. As I told you, the capacity itself is very less. But do not give a lot of water for the baby, okay? Because your breast milk provides enough hydration for the baby in the initial 6 months. After 7 months, you have to focus at least 60 ml, then to 90 ml, then to 120 ml. So the amount of water to be increased, where you can achieve that by just giving 1 tablespoon or 2 tablespoon or half a katori of water after every feed. So if you are feeding for 3 meals per day, give 30 ml, 30 ml, 30 ml. Like that, you can just give it. Okay, just few sips of water is more than enough. Initial days, giving water is to remove the debris from the dentures. Okay. Now, bottle drinking should be avoided. As I told you, the nipple feeding, bottle drinking with the water not to be given at all. Give it in open cup or sippy cups, or it can be a tumbler, or it can be a katori or spoons. Okay, but do not give it in the feeding bottles. And avoid sugary drinks, fruit juices, whatever it can be. So they will say it's a sugar-free product, but the hidden sugars, which is artificial sweetener like sucralose, being added. So always keep in mind, do not give all these sugary products for the baby, not really recommended at all. So no packet food, no maida based items, no biscuits or something like that to be added for the baby's diet. No pastries, nothing. Okay. Whatever you're doing, do it at home. But when you're traveling, you can give fresh fruits. You can give them steamed food like idli or dosa or chapati in a mashed form. In any form, you can give it, but do not give anything as a packed form when you're traveling or taking the baby outside. But this rule has been applicable for the parents too. Do not have anything as a junk or packed item in front of your baby. Then when you're doing it, obviously your baby will also start craving for it. And they will not, really be happy with not eating all those things. Okay. So ensure that you don't follow a improper diet in front of your baby. You have to follow proper diet, so baby will also have a good nutritional status and when they are growing as a toddler. And next is, when you're giving too much of sugary drinks, it affects the caries, and it causes dental caries and tooth decays. So better not to give any sugary waters or fluids. And what are the allergic signs to watch? So if the baby is having allergic signs, they will have hives and wheals. Hives and wheals are basically a red dark patches, which is larger patches, which has been there on the top of the skin all over the body. And swelling of mouth and throat will happen. They couldn't able to breathe properly, or they couldn't able to, talk, or there'll be some itchiness. Swallowing will be difficult. They will spit out. And vomiting diarrhea is very common, sometimes with the blood in it. And coughing and difficulty of breathing are common symptoms of food allergies. So to prevent the food allergy only, I told you to follow 3-day rule. So if you follow a proper 3-day rule, this food allergies can be identified and been measured properly. And apart from that, what are the foods that to avoid during the starting solids or till 1 year? So you have to avoid salt. Why salt? The sodium or sodium chloride present in the salt is not really recommended for baby's age. So after 1 year only, the requirement is needed. So till 1 year, there is no need for adding salt. But don't worry, the baby will not have the salty taste and all. But if you feel the baby is having any salty food, or the baby is craving for it, you can add some amchur powder on top of it, or lemon juices. But do not add direct salt in the baby's food till 1 year. And second is sugar. Sugar, you have to avoid it completely. But after 10 months, you can, if you want, you can add few jaggery powder to it, but do not, or dates pureed or fruit sweetened one, but do not add direct white sugars in the baby's diet till 1 year. And third is honey. Honey causes infant botulism. That is a bacterial infection which is very detrimental, and the mortality rate is very higher. So you should not give honey for the babies till 1 year of the baby's age. Okay. Fourth is whole nuts. Whole nuts are basically the choking hazardous one. So better not to give for the baby. It is also allergenic too for few babies. And fifth is foods with choking hazard risk. Basically, the prunes or dried grapes or peanut butter, or it can be meat or any non-veg food, or it can be a hard particle like rusk or something like that, or raw vegetables. All these things, or I would say the tampering which we do, no, jeera, or it can be the chana dal, whatever, they couldn't able to chew it properly. So all these things to be properly measured for the baby till you texture transit for the baby till 1 year. Okay. And egg whites. Egg whites has allergenic reaction, so it's better to avoid till 1 year. After 1 year, you can start with the egg whites, but egg yolks can be started from 8 months of baby's age. And cow's milk. Cow's milk, the lactose content present, which has been causing a lot of lactose intolerances and cow milk protein allergy. So all these things can be prevented. So till 1 year, you have to avoid cow milk. So you can start giving cow milk after 1 year only, not before 1 year. Okay. So these are the major foods to be avoided. And when you feel that the baby is starting with the solid, and when you want to know that whatever you are giving or feeding the baby is right or wrong, ensure growth monitoring is more important. So growth monitoring is baby's head circumference, length, and weight, which has been increasing. It means the solids, whatever you're giving, is good for the baby. Okay. So monitor properly and ensure that you follow up with the pediatricians and nutritionists in Cloud9 Hospital to make sure that you are giving right for the baby. So keep in mind that quantity matters. Quality is more important, because micronutrient deficiencies are very common for all the babies in the rural population. So keep in mind the variety of food is the nutrient giving factor. To just give ragi on a daily basis, ragi porridge in the morning, curd rice or dal rice in the afternoon, this will not help the baby to grow. So you have to give varieties of fruits, vegetables, varieties of cereals, millets, and adding fat. Oil is more important for the baby's diet. Just going with ghee or just adding oil alone will not help. So you can give ghee few amount, and oil is very important to cook the vegetable. Do not give oil-free diet for the babies, keeping your health in consciousness. Okay. So babies are in need of oils and fatty acid, which will help them to grow better. Okay. And prevent malnutrition. But do not just go free of any of the fatty food items for the babies. Okay. So, and apart from the starting solids, Cloud9 also give other nutritional services like the baby's low weight gain or preterm or pediatric obesity or caramel protein allergy intolerances or gluten allergy, any inborn errors of metabolism. You can also feel free to contact us in any form, okay? Via video consultations if you are somewhere apart from Tinagar, or you can also directly walk into our Cloud9 hospitals and you can take up your appointments, okay? So there is also a starting solid course by Cloud9, which is available in the apps. So where you can scan this QR code and you can just go inside and register yourself, where you can access the recorded session for free 1 year, and you'll be getting one e-PDF book of starting solid guidelines. So you can avail and use all these things. You can learn and you can make your own experience. But in case if you want one-on-one consultations, or if you want to spend a lot of time with the qualified nutritionists like us, then you can also attend the workshop which has been happening monthly in all the units pan India. So you can go and register yourself with your CREs, and you can ask the dates. You can also go and attend the starting solids course in any of the dates being fixed. So you can either go for courses by Cloud9 on online, or direct with the nutritionist in the hospital. or it is also available like a recorded session too. Okay, you can always reach out to our CREs and coordinators to get more details and insights about it. Thank you so much, and I hope that you have learned a lot of informations about how to start solids, what is 3-day rule, and how to feed the baby with seated feeding, and ensuring that the texture transition is more important, varieties are important, and what are the benefits of starting solids for the baby. Okay, so now we are really ready and happy to quickly take up your feedbacks and questions. Over to you, Kirtana.
Thank you so much for the detailed and wonderful presentation, Haripya. So, before I start with the question and answer, I here have an announcement for the audience today. So, since you have all joined us for the webinar, we have an exclusive offer on this particular Starting Solids course. I will be quickly sharing the course link in the chat box. So you can just tap on the link and put up the coupon code there. So like that is mentioned there. So you will be able to avail the offer as soon as you put up your details. So I'm repeating again, the course is called Starting Solids, done by Cloud9 Hospital MBA team. So yes, here is a link and the coupon code for you all. So yes, so starting with the questions. Yes. Okay, there are a lot of active mamas here, starting with a question from Miss Vinita. My baby started solids and fell ill after a week. She's having cough and cold. During this time, completely rejected food, like not even showing interest or opening his mouth. Will this go away or what should I do?
Yes, yes. So, Vinitha, don't worry about this because generally babies acquiring cold, cough, or infection is very common. Only if they acquire all these infection, their innate immunity is being developed. Okay. So, what will they do is their gut health is little sensitive when they are having any illness. So, they'll be on medications. They might have acidity or they might have reflex feeling or pain. So, due to that, the baby will be little cranky in not having solid properly. So that time, the few pointers to kept in mind is do not start anything new when the baby is ill. Okay. And second important, do not force feed. Even if the baby is having two mouthful, that's more than enough. Third is feed on time. The baby will have maximum appetite in the morning, early morning. So when you're giving breakfast at 10 o'clock, 11 o'clock, or giving it on your own time, it will not help. Ensure you start baby's meal giving breastfeeding, soothing them, then at least by 8 or 8:30, you should start the breakfast for them. So give something small, frequent, but very little. Do not go on with a larger meal at one shot. And give them something steamed, like it can be a dokla or it can be some steamed idlis or dosa, or it can be few khichdi, or it can be rice granules or purees or kanji or porridge, whatever. But ensure that is being little appetizing. You can add some flavors like jeera powder, few peppers on top of it, some ginger or turmeric. This will help them to recover from the illness. Okay. So something small, frequent, but do not show any anger face in front of the baby. Okay. Ensure you feed with love. You have to ensure the baby is getting better and settled. Your positive thinking will help the baby to analyze and understand, and they will get better soon. So this is very common, but do not show your anger to the baby. Feed very patiently and slowly. They will actually, get it better within 2 weeks. But this will go away. This is not a picky eating start for the baby. Don't worry. Okay.
So next question is from Miss Survi. Can we add salt and sugar in the meals for 6 months baby?
No, it's a complete no. So salt, sugar, something as a white to be avoided till 1 year of the baby's age. So no salt, no sugar. But where you can add jeera powder like cumin powder or coriander powder, or it can be pepper or amchur powder can be started after 7 months. The concept is basically to give single ingredient at a time. The baby should know the original taste of carrot, beetroot, rice, and everything. So if you add on or mask the flavor with salt or sugar, the baby will not have other foods in future. So they will become a picky eater. So that is the reason why you should avoid salt, sugar, something flavor enhancing. before 1 year. And also it affects the kidneys, and it might also land up in picky eating, like too much of fried food in the cravings for future, or sugary cravings that can be avoided. Okay, so that's the only reason you have to avoid salt or sugar or flavor enhancers till 1 year. Okay, fine. Then
So for making puree from cereals, we need to boil them first and then puree it, or is it like cooking it and then?
so it's like you have to boil, you have to cook it entirely, then you puree it. One. So cereals, what you can do is, for example, I'll tell for ragi. Ragi, there are two methods that you can follow. You can dry roast it, you can powder, you can make puree out of it. Okay. Second is you can just soak it, sprout, and then you can extract the milk out of it. Then you can just make a boiling, good boiling, make it as a puree, then you can feed it for the baby. So it's like your choice. Either you can dry roast, powder, and give it as a porridge, or you can just sprout, powder, give it as a porridge, or you can extract milk from it, make it as a porridge, and give it to it, give for the baby. Okay, anything is fine.
Okay. So do we have any specific rice that should be given to the baby, or we can give any rice?
No, whatever's being used at your home, like it can be a raw rice, or it can be, any varieties of parboiled rice, or it can be anything. It can be red rice, whatever. So whatever you're being used at home, you can start for the baby. So in first initial days, it's better to start with raw rice or with the parboiled rice.
Okay. So can we give millet with pulse puree to a 6 month baby?
Millet with pulse puree. Say if you have already started with solids like millets alone and pulses alone, if that has been introduced, then you can give mixing of ingredients, but do not start with the mixing of ingredients itself. So baby should know the millet taste is this, pulses taste is this. That is the concept. Nothing harm. You can give, but it's better to start single ingredient in the initial days.
Okay. At 6 months, what is the count of the meal that the baby should have, even after excluding the breastfeeding?
Okay. So excluding breastfeeding in that initial 6 months, it can be one or two.
Okay. What food, green vegetables, can we give it to a baby?
So green vegetables like palak you can start, or moringa powder you can add it to the idli or whatever, the dal tadka, whatever you're giving. So these spinach and other varieties of greens can be first started as a soup. So you can make a good soup and you can start babies with that. Then once the baby is getting settled, there is no food allergies, and the baby is loving to have those soups. Then you can start giving mixing of spinach with the rice. So rice and dal, or it can be, rice, dal, and greens, or it can be greens and dal. Like that, you can mix and give, like a koot or as a poriyal or sabzi. Like that, you can mix and give it for the baby.
Okay. Baby is 4.5 months old and has itchy gums. He is getting irritated, and what should I do to avoid this?
Baby is 4.5.
Yeah.
Okay, please do consult your pediatrician. Okay, if the baby is having itchy gums or something, it can be a fungal infection because you're breastfeeding, right? After breastfeeding, you have to you have to clean the baby's gums properly. The baby is sleeping with the breastfeeding, of the milk is being present there for a longer period of time. As the milk has sugars, okay, the naturally occurring sugars in the breast milk, the baby might have fungal infections. Okay, so it can be an initial starting stage. Please do consult our pediatrician, then you can correct it accordingly.
Can you share any food chart for all the moms here?
Food chart, you have to consult our dietitian in the Cloud9, then you can get it for sure. Because I cannot randomly say this, and that. We need to assess the baby's birth weight and the length of the baby, then any medical conditions, then how the baby is having food, and what are the other aspects like the mother's socioeconomic status, or it can be the environment, or the counseling will be very much different. So for the food chart and everything, you can always reach out to us, to any of the nutritionists in Cloud9.
Okay. Can we give cooked rice as smashed in 6th month?
Cooked rice as smashed in 6 months. Yes, you can give.
Okay. So, what kind of allergy will happen if food doesn't pass the 3 days rules?
What kind of allergy happens if food doesn't pass 3-day rule? Okay.
Yeah.
So generally, not all the foods are allergic, right? So what you can do is you can either, it's better to start with 3-day rule, or you can give the baby routine food, okay, in the daytime alone, okay. Not much of a benefit, but it's better when you're starting with spinach or eggs or non-veg, or it can be some millets like ragi or something like that, or it can be even wheat. Wheat is allergic, okay. So these things mandatory, you have to do the 3-day rule, then you have to give it for the baby.
Okay.
Dal are not allergenic. Dal, fruits are not allergenic often. So the common allergenic foods are eggs, nuts, and milk, and it can be gluten, which is wheat. So these things are allergenic. But it's better, that's a rule to start with a 3-day rule whenever you start anything new. Even if you have already started, don't worry. But now, further days, you just start with the 3-day rule, then you can, feed your baby accordingly.
Okay. So, moms wanted a chart of number of meals to be given with respect to what month the baby is in.
Uh, See, everything is a personalized here, okay, and we cannot give a lot of information just with few, restricted time. So you can always reach out to us to just get a complete chart.
Okay. So, any specific food that we have to avoid for a baby with silent reflex issues?
I didn't get what? Any foods to be avoided?
For babies with silent reflex issues.
So silent reflex issues, if the baby is having it, it's better to feed the baby very slow. And reflexing is basically if you don't make the baby sit in a proper angle. So ensure the baby seating, is proper. So reflexing issues might happen when you give a larger meal at one shot. And the baby is more than 9 or 10 months, make sure that you don't add much of a masala items to it. Okay. The baby, you have to teach the baby how to chew and swallow it properly. You have to do it in front of them so that the reflexing, the acidity or the GERD can be prevented. But do consult your pediatrician if the reflexing issues are very common. Okay, the splitting or the curdling of whatever food they're eating, or it can be a vomit sensation, or it can be crying or refusing of foods. You have to ensure you just meet us directly and take a personalized guidelines with that. Okay.
Okay. Can we use high chair before baby started sitting, but having good head control?
Okay, so try making the baby sit in high chair, but the baby will have a less support of sitting. Then you can make them to sit, okay? Because the seating, the high chair has a belt in it, like a seat belt in it. So you can make the baby, sit on that with the help of the belt, okay? But if you feel the baby couldn't able to do it, then you can make the baby to sit on your lap and make them, just get the support from yourself. Then you can feed the baby in the initial stage. Then you can slowly start with the high chair seated feeding.
So, are there any specific food that will help in baby's weight gain?
Okay, there is no one food for weight gain, but I would like to list out few ingredients that will help them for the weight gain. First, the micronutrient deficiencies, we have to correct it. So what you can do is ensure that you cook vegetables with some oil, which will help the baby to improve on their weight. Second important thing is you can make them, feed frequently. That is like breakfast, lunch, dinner, and it can be two snack. Okay, if the baby is more than 8 months. Okay, so these things will help for the weight gain. And apart from that, giving proper texture transition. To texture transition, you have to ensure that the puree is thick. It should not be like a watery, as I told you. Okay, it should not be just like a watery one. Not like a too much watery one. It should be soft and smooth. So all these things will make the baby to gain weight. And in case of any supplements to be added, we can just go on with that. Okay, but if you want, you can just ensure that adding a proper food groups of cereals, pulses, you can add ghee in the baby's diet, but split and add. So I have seen mothers just adding 1 teaspoon of ghee to, just a small cup of food. That should not happen. So when the baby is having a larger amount of fat at one shot, if their capacity is very less, they will eat only two mouthful. Okay, but if you split and add the ghee, like 2 drops in the morning, 2 drops in the lunch, and 2 drops for the dinner, or splitting and having it like 3 or 4 drops, then it will be easier for the baby to have it along with the food. But do not, put 1 tablespoon of ghee or 1 teaspoon, the entire ghee in one meal alone. That will make the baby feel satiated very earlier. Okay.
Can we give avocado puree in 6th month?
Start from 7 months. Avocados are little, like the texture is little thick. So you can start from 7 months.
So the question from Ms. Apurva is, can I breastfeed the baby right after solid if the baby is demanding for it?
Yes, you can do that. It can be for the, hydration, but ensure that you reduce it by giving solid. Initial days, that is fine, not a problem at all. Next question.
Is there anything that we shouldn't give carb foods right at the beginning stage of feeding solids?
No, nothing like that. Nothing like that. All the carbohydrates are safe. Okay, but in the initial days, as I told you, rice, ragi, wheat can be added. And apart from that, slowly you can start with suji or like rava, or it can be sabudana, like in a powdered form, or it can be poha, or it can be any millets in a sprouted and powdered form. So carbs are not a problem at all.
Do we need to give finger in chopped food? Is it to be given in boiled form?
I didn't get you, Kirtana. Which question are you reading?
So do we need to give finger food and chopped food? Uh, and is it to be given in the boiled form?
Yes, finger or chopped food, whatever you're giving till before 1 year should not be raw. It should be in a boiled form only. You have to boil, then you cut. Don't cut and boil. The nutrient deficiencies are very higher. The water soluble vitamins get leached into the water. So better you boil, then you cut the vegetables.
Okay, what is the ideal time to give a puree to a baby that is at 6.5 months?
Ideal timing in the sense meal timing is little different. Okay, you can first thing in the morning you can start. But starting with puree, you can start from first food itself.
Okay, moving to the next question. Till when we need to follow this 3-day rule so as to start the combination food like rice and pulses, all that?
Okay. So this 3-day rule is important when you're giving something new only. But when you're giving combination of food ingredient, not really needed. Like rice has been already given, dal has been already given, the 3-day rule has been passed, carrot has been given, apple has been given, not really needed. So this 6 months alone. First 1 month is like trial and error method. 3-day rule, you're gonna give something new all the time. And from 7 months, you can give combination of food. During that time, the 3-day rule is not really needed.
Okay. So there is a question called like I started giving solids to my 7-month-old and he is pooping very solid. Is it normal?
Yes, that is very normal. If you feel that the baby's poop is like a pebble shape, then the water intake and the fiber is very less. So one thing that you can do is step up the water intake. Second is when the baby is passing pebble shaped motion, you have to keep in mind the texture is not adequate for the baby. So don't give puree all the time. Give 3 meal of mashed food. So that will improve the baby's stool consistency. And third important, start giving curd if the baby is more than 8 months. Okay, you can start with curd, which will help in improving their gut health.
Okay. So moving to the next question from Ms. Thara, which is similar to this question. My baby passing poo 3 to 4 hours after having food. Before starting solids, he used to pass poo once in a day or once in 2 days. So now does it twice than before. is this normal? It's been 10 days
It's very
since we
normal.
started
It's
solids.
very normal for the babies to pass motion after eating. It's very normal. Need not worry about it. The frequency increases, yes, because the baby doesn't have that, reflexing to hold the poop because the gut is not really matured. So that will happen after 1 year, the frequency will get reduced. But generally, all the babies, after having food, they'll poop. That's fine.
So, can we start solids for babies that are at 5 months? So, this is one common question. 5 months and 4.5 months are common question that I see in the chat box.
Yes. So 5 and 4.5 months is absolute no based on the guidelines. It's from 6 months of age. But just knowing what to start and what not to start for your baby in the initial 5 or 4.5 months is the better option because you'll be mentally prepared how to feed the baby properly. So it's usually from 6 months of start. That's 5.5 months and 31 days. I would say it is a 6 month. You can start solid. It's not a problem at all. But ensure that you go for pediatrician's advice and vaccination will be done, then you can start with the solids. Okay, but if the baby is little less in weight or the baby is having any issues but the baby is ready for solids, then for few babies we do start, but not for all the babies. Okay, but do not start anything on your own, that will really affect the baby's health.
Okay.
Only after 6 months.
Okay. So my baby is 4.5 months old and passing poo in green color, and he's taking formula milk and breast milk combination. So is this a problem or is it common?
It's very common. Very common, need not worry. Green poop, dark color poop, gray poop, or it can be, initial days after the birth is common. And green poop and light yellow color poop are very common for the babies. Okay, only if you spot any mucus and blood in the baby's motion, then you have to for sure meet up your pediatrician. The baby's crying while passing motion, can be a colic issue or something like that. Please do consult your pediatrician.
By 2 to 3 meals, it should be different food or same food. What will be the timing difference that we can follow for this 2 to 3 meals a
Yeah.
day?
So what? Okay, Shweta. So what you can do is, if it's a 2 or 3 meal, one meal can be cereal, one meal can be fruit, one meal can be vegetable. So different food groups you can give. It should not be the same food like carrot, carrot, carrot 3 times. Should be ragi, carrot, and apple. Like that you can give. The timings can be 2 hours once or 3 hours once based on the baby's sleep timing and waking up time. For example, if you're giving starting first meal at 8 o'clock, then give again one puree by 12 o'clock and again by 4 o'clock. And then when the baby is growing up larger, that is the age is getting higher, then you can start with the breakfast, mid-morning snack, lunch, mid-evening snack, and early dinner. Like that you can give.
Okay. Can we use straw bottles or super bottles?
Straw bottles can be started after 8 or 9 months, but not in the initial days. They couldn't be able to sip it properly. But open tumbler you start. Straw bottles can be started after 8 months, 8 or 9 months only.
Okay. So when can we start citrus fruits for the baby, like orange or
That's a
strawberry?
very good question. Okay, it's a very good question. So citrus fruits can be started after 8 months, where diluted vitamin C juices can be given, like lemon juice or Mosambi or orange, something like that you can give for baby after 8 months. Okay, just 1 tablespoon is more than enough. Okay, this is like a vitamin C supplementation for baby to prevent any future infections, allergy, to improve the immune function of the baby. So you can start giving this vitamin C citric item after 8 months in a diluted form. Don't add sugar, nothing to it, just the diluted form of the citrus. No sugar or sweetener on top of it.
Okay. So can you please share the chart of water per day per month?
Water per day per month.
Yeah.
Per month, there is no requirement. Per day, it depends on each baby's weight. So I would suggest at least giving 60 ml to 120 ml is the ideal form
Okay.
per day.
Okay. So I think you have answered the next question also by then. So moving to the next question, when can we start powdered dry fruits?
And one more about the water. So you can give 30 ml or 1 teaspoon of water after every feed. But if the baby is refusing it, you can give it during the play time. Okay, but it's not mandatory to give it, along with the meal. Okay. So when can we start with powdered dry fruits?
Yes.
Powdered dry nuts or fruits can be started after the baby is 9 months. Okay, like it can be powdered cereal or powdered, nuts or something like that. But ensure you just give single nut at a time. Do not soak all the nuts together, make it as a paste or powder it, then make porridge out of it. Give almond alone, cashew alone, or it can be anything, the single ingredient. Then you start with mixing everything after 1 year. So almond alone, you can add that powder alone. You can add it to the purees of the snack of the baby's meal. Like ragi porridge, you can give almond puree. You can top up with almond puree. If it's a any fruit puree, you can top up with some nuts puree. I mean nuts powder on top of it. Like that you can do. But do not just like that. Add the mix of fruits or dry fruits. Make it as a puree and feed that alone for the baby. Do not add mixture of n number of ingredients. Ensure it's one or two max.
Can we give glucose biscuits after 8th month, like Parle G biscuits?
Okay, so that too depends because 8 months is like teething phase. Okay, where I would suggest you to give some wheat biscuits, or it can be a ragi biscuit or a finger biscuits, like soup sticks. We say no, that soup sticks you can give, but do not go for something as a milk bikis or creamy one or something like that. Okay, so Palaji is okay. Very very rarely you can give, not often. There are a lot of healthy cookies that are available for babies. You can check in, Mama's app.
Okay. Can we give ghee and jaggery to a 6 months old?
No, no, no. Ghee you can add, but not jaggery. Jaggery after 9 or 10 months only. But ghee, yes, you can add few drops of ghee. But initial days, first food for the baby, first 15 days, don't add anything. Single ingredient only. Because only one meal you're going to give. Okay. After 15 days, when the baby is ready for everything, you can give hot rice with some ghee on top of it. Like that, you can, feed the baby. Ghee, yes, but not jaggery.
Okay, what to do when the solid introduction causes constipation and how long the baby can go without potty?
So it can be for 1 or 2 days, okay, or it can be alternative days. That's not a problem at all. But the baby will increase the frequency of motion once you change the texture of the food. So from puree, it can be 1 day once or 2 day once. From mashed form, it can be on a 1 day once. From the solid form, like a finger food or like a semi-solid food, it will be daily basis. So it's not a problem at all. The baby is having severe constipation, like not passing stools for 4 days and 5 days. We have to work on to the fiber. We have to work on to the entire diet, and we can start with any fiber supplements if needed. Otherwise, not really needed. You can just start giving a proper food. Ensure that the diet you are giving for the baby is correct, and then you can go on with the medications.
After giving puree to 6 months old, can we give few drops of water?
Yes, you can give few drops of water.
Okay. Moving to the next question, if we start solids, then is it necessary to skip one of the breast milk feed a day?
Not really needed. It's not like skipping of your milk. It's like replacing it, I would say. So, yeah, obviously, yes. So when you're feeding the milk, breast milk, in the morning, you can feed in the morning. Then after 2 hours or 3 hours, you can give solid food. Then wait again for 2 hours or 2.5 hours. Then you can feed the baby if the baby is cranky. Otherwise, you can wait till 4 hours also.
Okay. So my baby is 5 months old now, and I'm not able to produce enough breast milk, and my baby is not taking formula milk. What should I do?
Okay. 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 So, when the baby is like that, you can probably, try solid based on the pediatrician's advice, and you can feed the baby in alternative ways, like you can pump express and feed the baby breast milk, or if you're not getting enough formula milk, ensure you reduce the quantity, start slowly increasing the quantity of it. But if you feel that the baby weight and the length and the growth is adequate, do not worry about this. Okay, the baby might feel that the quantity is a little higher and frequent. So ensure you just talk to the lactation consultant, and you can, either you can go for formula or breast milk of the varieties accordingly. But do not start with solids now. 5 months is too early.
Okay. So how egg yolk should be given? Should it given out of the boiled egg?
Yes, exactly. So egg should be boiled, and remove the white part. The boiled egg yolk, you can mash it and give it for the baby. Just half first. Then you can mix it with the rice and give it. Or it can even be a scrambled egg yolk. Not a problem.
Okay. So can we give buffalo milk to a 6 month, like after 6 months?
Complete no. It's a complete no. No milk till 1 year. It can be a buffalo or cow milk. No milk till 1 year.
Okay. Can we give paneer prepared from cows or buffalo's milk?
That's a good question. So you can give paneer or cheese, or it can be anything. But cheese after 1 year only. Paneer can be given after 8 months. So you can give paneer bhuji in a grated form, but homemade paneer. You can prepare your own paneer. You can mix it with the chapati, paratha. You can give it for the babies after 8 months. So curd paneer can be started after 8 months.
Okay. So what about coconut milk or almond milk or paneer milk or curd? When to introduce?
Coconut milk, almond milk, or paneer or curd. Okay, I told you coconut milk and almond milk you can start after 10 months. Okay, after 10 months. Paneer curd after 8 months.
Okay. So can Dahlia with cow's milk given at 6 months?
No, dear, no. See, cow milk to be avoided till 1 year. That's because, based on the Indian Academy of Pediatric guidelines, better to avoid. But rather, you can mix dalia and rice together and give, or dalia and vegetables together you can give. Okay, but do not mix cow milk and give for babies. Online doctors, I would never say doctors will suggest, our pediatrician will never ever ask you to give cow milk till 1 year. So please look on to the qualification and go for it. But it's a complete no to give milk till 1 year. And when you're giving paneer or curd or something like that, ensure it's being made from the pasteurized milk. It should not be from the direct cow milk or raw milk. It should be a pasteurized milk. You have to make curd and paneer out of it. Okay.
So from when we can start the black urad dal powder?
Black what? Urad dal
Urad
powder.
dal powder, yeah.
You can start in the initial months itself. That's very safe. Urad dal powder, you can start from initial months.
Okay, I think you have answered the question on badam and cashew powder. Moving to the next question, which oil to use in veggies?
Which oil?
To use in vegetables.
You can use gingerly oil or groundnut oil or rice bran or mustard oil. Any oil is fine.
Okay. So I did not use 3-day rules as I was not aware, but thankfully no reaction. Can I start the 3 days rules formula now?
Yes, yes, you can obviously start. Obviously, you can start.
Okay. Can we give the bought ragi powder cooked in boiled water?
Yes, you can also do that. So when you're working mother, resuming your work, you can buy store-bought, but buy the sprouted ragi powder. Sprouted ragi powder is better tolerable. You can give.
Okay. So can we give orange juice in the morning after the baby wakes up?
Not first thing in the morning. Rather, you can give it in the mid-morning. Give a meal, then after that you can give orange juice in the mid-morning. But don't give first thing in the morning. It might cause a reflexing feeling for babies.
Okay. So on giving carrot puree, baby passes the few amounts of carrot puree as such in stool after few hours. Is this
That
normal?
is very normal. That's very normal.
Okay.
Change of color, seeing few particles of food in the motion, it's very common. Yes, normal.
So can we give banana to baby in Delhi NCR as in colder weather?
Okay, so if the baby is having any phlegm secretion, or it can be a cough or something like that, you avoid giving banana late in the night. But in the mid morning or in the daytime, you can give the smaller banana with less seeds. Like it can be a lucky banana or any smaller variety, which is like a mashed form you can give for provided for babies. Just half per day is more than enough. Half or one small one. It's a bigger one. Just give 3/4 or half of it.
Okay. How about giving a mashed papaya?
Yes, you can give papaya. Papayas are safe. Mashed papaya, yes, it can be given.
Okay. So, is it necessary to start solid only once the baby is able to sit? Because my baby has finished 5 months now and he's not able to sit.
Not a problem at all. The baby will learn. Okay, see, Papa is just 5 months now. So baby 5.5 months or 5 months and 30 days, Papa might try to sit. So need not worry about it. Baby will try. Milestone will achieve. But solids can be started by 6 months. Why we always say sitting is more important with less help is the baby will have a proper GI tract. So if the baby, when we are feeding food for the baby could able to swallow and the digestion will happen properly. Soon after the meal, if the baby is just lying down or you're making them to, lie down like a up and down, then it will be like they will reflux or they will have heartburns or digestive issues. That's the only reason why we always say the baby should sit at least with less help and start feeding. It's not a problem at all. The baby will learn.
Okay, moving to the next question. Shouldn't we give fruits at first before the grains?
Fruits before the grains, not really needed. Anything like it's not first thing you have to start with grain and fruit and vegetable. It's like anything. First fruit, second can be grain, and third can be vegetable. Anything is fine.
Okay. So our pediatrician suggested to follow 20 days same food like dal for 20 days, then switch to porridge. Will this lead to any deficiency?
No deficiency. The baby will feel bored.
Okay.
They have to give 3-day rule is more than enough for the allergies. There is I haven't heard about 20-day rule. That's not practically possible. They can give 3-day rule. That's more than enough to identify the allergies. And 20-day rule is not really needed. I would say 15 rule is because to avoid any picky eater. When the baby is refusing any specific food, like it can be a bitter gourd, it can be any varieties of fruit or vegetable or cereal, the baby is specifically avoiding the taste of it. You can try in different forms for 15 times. Okay, then you can the baby will try to touch it, to take it, to mash it. Then they will try to keep it in their mouth. But 20-day rule not really mandatory.
Okay. When to add oil in the food?
You can add oil, ghee from 6 months, oil from 7 months.
Okay. So my baby got fever after introducing solids. This is normal.
That's very normal. That's very not because of the solid. It can be because of the climatic changes or infections. So need not worry about it. It's not because of the solid food.
Okay. So right after starting solid foods, babies are feeling constipated. So what will be the solution for this case?
See, constipation is basically when the baby is not passing stool for more than 2 days. That is called as constipation. If the baby is, passing motion daily basis, but the baby is feeling difficulty in passing, like hard stools or something, that is a hard stool. So when you step up water, when you give a proper texture transition, the baby could able to, poop better. Excuse me. So not a problem at all.
So Ms. Jyoti's baby completed 7 months today and started giving purees, but he's not opening his mouth or he's not interested. Seems like he's not interested. He's spitting it out. He's not really keen on food even when they're eating food in front of him. So what do we do in this case?
Okay. First thing is ensure the baby's meal timing is on point. So, for example, if we say when we are hungry, when we are not getting food on time and you have skipped that meal, the next meal either we overeat or we feel very acidic or pain in our abdomen. Same thing happened for the babies too. But the baby will become cranky. They will not have food properly. And second, ensure that whatever you're feeding is not being force fed. Only if you force feed the babies, the baby will be having all these behavioral issues. Even if the baby is not eating for 2 meals, please leave them. Let them rest for a while, and after the next meal, you can try giving. Even if they're refusing it, the next day you can try. But keep breastfeeding. But do not never ever force feed them. When you're force feeding them, they will create a negative aversion or negative, relation towards the food. So force feeding is a big no for all.
Okay. So are there any difference between a formula fed baby and a breastfed baby, like in starting the solid food?
There's no much of a difference. Both the babies are healthy only, so need not feel guilty or worried about this. But sometimes it's like formula fed babies will seem to look high in weight because of the sugary content, but that is very common. Both the babies are healthy. Do not compare with all these things. Don't worry. And one more thing for the picky eater question, which I answered before. See, what you do is you just start including something colorful, different in shapes and texture for the baby. 7 months, no? Different texture and shape for the baby. So baby will be happy to, pick up and have it. And make the baby, play with the food. So when the baby is playing with the food, like buying groceries or cutting, washing them, or just being with you when you're cooking and showing and learning about the food will make them feel more interested in having food. Should not be like meal time. Okay, sit and have food. I have to finish off my work. I should go on to my next work. No. So it's like a learning process for them, learning for you as well as for the baby. So we are just giving food as a food, they'll not eat. So make food as a learning, fun, and everything. Just giving few amounts of food in the hand and then feeding the baby will work. But just feeding the baby alone, thinking that if I give food in a sand, he will make it up messy. The entire flow will be very bad. If you're thinking like that, then the baby will become a picky eater. Baby will, just spit it out. It will be messy for sure. But be patient and start enjoying it, thinking that the baby is learning. Because I've seen many of them just restricting the babies, not making them to explore. Just do it for 3 months alone. After 1 year, they will start to learn, how to sit in the chair and how to, take and have food without spitting out. All these things they will learn. But being messy and avoiding or restricting them on the food, it will make them become a picky eater. So that's the one thing which I want to address here. Okay.
Can starting solids be delayed for 10 days after completing 6 months?
Not a problem. No problem. You can
Okay.
give it after 10.
Okay then. So yes, we have few questions about the course. We will share it right away again before we close the session. And we also have offline events, one-on-one events that are happening in every unit. You can talk to your CREs or GREs to get more information about that. Moving to the questions, like my baby is turning 6 months next month. And what can I give on the first day to start off with? And can I add little amount of water in the puree?
No problem, you can add water. First food, as I told you, it can be rice, ragi, wheat, and few vegetables and fruits can be added, like apples, stewed pears, and it can be, like papaya or banana or chiku, something like that. And vegetables can be sweet potatoes, pumpkins, and it can be carrots and beetroots.
Okay. So since we are giving the food in a very small quantity, can we prepare this food and store it in fridge for like 3-4 hours?
No, cook fresh, feed fresh. But when you're traveling or coming to the hospital, when you want to feed the baby with the purees, cereal puree lasts for 3-4 hours. Vegetable or fruit puree just for 1 hour or maximum 1.5 hours. After that, it will become stale. So you should not, keep it. But refrigerating it, ensure you refrigerate, thaw it properly, and give. Thawing is like in a normal water. You have to keep it inside. Then you thaw it. You should not just cook it again.
Okay. So my baby has finished 6.5 months and he's still on breastfeeding. I have not started solids. Is this okay?
That is okay. You can start solids now.
Okay. So I'm skipping few questions that are repeated. So Then moving to the next question. Can we mix fruit pulp with breast milk in the start?
Yes, you can give. Not a problem. Yes.
Okay. Can we give Nestle Cerelac to a baby of 6 months?
No, dear. No Cerelac. No product one. But homemade Cerelac you can give like after 6.5 or 7 months, where you can add poha, few cereals or rice-based items with the pulses like moong dal or something like that, or some roasted Bengal gram dal. You can make a nice gruel. You can make out of porridge out of it, but do not buy the commercial forms of Cerelac.
So, should we steam the banana before introducing it to the baby?
We steam, not really needed. You can
Okay.
just mash and give.
Okay. How about giving potatoes to the baby?
Yes, you can give in a pureed form. Boil, mash. If you want, you can loosen up the consistency, then you can give.
Okay. So, what is the frequency? How do we increase the frequency of the meal from 1 to 2 times for a 6-month-old?
Okay, so when you're increasing the frequency of the meal from 1, 2, or 3, it's like when the baby is eating enough quantity. 2 tablespoons reach, okay, to frequencies of the food. Okay, so only thing is initial 6 months we are just analyzing the allergies of the food for the baby. When there is no allergies being monitored, then you can just introduce next meal and next meal. As I told you, first 3 days only it's gonna be one meal. So day one rice, day two rice, day three rice, and day four you're gonna start with any one new food, and the second meal can be rice. So day four can be apple, second meal can be rice. Day five can be apple, second meal can be rice, like that. Then after finishing 3-day rule 6 days, day 7 can be a pear or a potato, and the second meal can be either a rice or an apple. So you can just give, huh? So 2 meals, yes. Then you can slowly move on to 3 meal, where ideally 7.5 months you can start with 3 meal, where it is a breakfast, lunch, and evening snack, not a dinner. Dinner can be started from 8 months. That's so early dinner. Early dinner, if I say, it should be by 7:30. It should not be 8:30, 9:30, 10 o'clock. No. And after 7:30, when they're feeling hungry, give breast milk and formula.
Okay. So, can we use silicone food set like utensils? If yes, how do we sterilize it?
Baby friendly silicone food sets are fine. But if you're sterilizing, this is sterilizer. You can keep it inside, sterilize it, and give.
Okay. In case of any food allergy, what should be the immediate step?
Do meet, run to the triage, do meet a pediatrician. You have to do that. You have to go to the hospital. If the
Okay.
food allergies are, the signs are common, please do meet a pediatrician.
So my pediatrician suggested iron drops and vitamin D3 drops. Can we mix it with a porridge?
No, 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 not with the food. You have to give it separately. Do not mix it with the food.
Okay. Can we give yellow egg while starting solids?
Yellow egg. Yellow egg, no, not while starting solids. Only egg yolk can be started after 8 months, not before that.
Okay. So my 6 months old's stool is still in very liquidy form and poops are 4 to 5 times a day. I've started with solids 3 days back, but
No
no change in
problem.
stool.
No problem. It's just 3 days. You wait till 1 month. No problem.
Okay. So then, can when can we start other lentils like black gram or chickpeas, etc., and other veggies like cauliflower, beans?
Okay. So you can start black gram as early as possible. Chickpeas, you can just, either you can sprout powder, give it as a, ARF powder, as I told you, on a top of feed for the purees. Or you can just mash it, give it along with the rice from 7.5 months. So all the lentils or pulses like chana, rajma, or butter beans or green gram can be boiled, double boiled, cooked, and been mashed and given from 7.5 months. Limited quantity, very less.
So some doctor says introduce solids to even before 1 year of the age. Is it okay? And what kind of allergens should we avoid till 1 year?
Okay, see, it's like if I say American Academy of Pediatrics, they all usually suggest you have to start solids, anything allergenic food before 1 year. Okay, because they have better immunity before 1 year. After 1 year, it's like you can go on with the normal food. But based on the Indian Academy of Pediatrics, that is the genetical, research paper, which is the, Academy of Pediatrics has been released. They say our Indian gut health is little different. Our, genetics are little different, and immune system are different, not like comparative with others. So when you're starting anything allergenic before 1 year, it might land up in any food intolerances and allergies. So always better only two things I told you. Eggs and cow milk or the common allergens. Okay, even fish you can start after 10 months. But eggs and milk alone you can start after 1 year, not before 1 year. This is based on Indian practical guidelines. You're not gonna look for American guidelines. Okay, this is a practical session I'm telling you, practical guidelines. So it's better if you're an Indian, please do, go on with starting, all the allergenic foods after 1 year, not before 1 year.
Yeah. So I think we've covered almost all the questions. We might have skipped few questions that are very similar to the previous ones. So I hope that the session helped you all today. And if you still have any queries, you can book an appointment through Cloud9 app. And Ms. Harpriya practices in Chennai branch. You can book a video consultation also. And the starting solids events happens one-on-one in every unit of Cloud9. You can also meet other nutritionists as well. And this session has really been fantastic, and we had really very interactive and engaging audience. And a huge thank you to Ms. Haripriya for sharing such valuable insights on starting solids. I'm sure many of us are leaving with today with a clear understanding of what we are doing to lead and feed our little ones to a healthy and better way to start off with. So we have covered so much, from the best first foods to introduce after 6 months to how to prepare and serve them safely. But if you're still eager to learn even more, we've got something special for you. Our starting solids course goes deeper into everything that we talked about today. Recipes like carrot puree, whatever we discussed today, we'll have a detailed description of all these things in the guide that we have in this course, feeding schedules, nutritional tips, and much more. And just because you joined us today, we're offering this course for a special discount of 20%. Just use this coupon code SSLive10 when you enroll. So the link is in the chat, so don't miss out. This offer will expire in a week. Once again, thank you, Ms. Haripriya, for being such an amazing speaker as always. And thank you for the detailed demonstration of what kind of utensils to use and what type of solid it will be when you make it as a carrot pyari and everything. So thank you all for joining us once again. We hope you're feeling excited and confident about starting solids with your little ones. Have a great day and happy feeding.
Thank you, Kitna. Thank you all for your time. And in case if you want to, address anything, or if you want to ask us any queries in between of starting solids, you can always reach out to our Cloud9 nutritionist, and you can always reach me out via video consultations as well. But be confident and, ensure that's the learning period for both parents and mothers. So happy feeding, and thank you so much for your time.